Doping. In this chapter, we will study concept and classification of doping, prohibited substances and methods, athletes' responsibilities, side effects of prohibited substances, ergogenic aids and doping in sports, doping control procedure, recapitulation. Benjamin Johnson is a Jamaican-born Canadian former sprinter. He had won men's 100 meters race in 9.79 seconds at the 1988 Summer Olympics in Seoul, South Korea. But he was found guilty of taking steroids. The chef de mission visited Johnson to collect the gold medal. She said, "We love you, but you are guilty." He was disqualified for doping, losing the Olympic title and record after 3 days. Doping is a global problem. The issue of doping in sports has been widely discussed, but what exactly is it? For more, you need to spend more time clicking. Classification of doping. Doping refers to an athlete's use of prohibited drugs or methods to improve training and sporting results. It also includes an athlete's use of other forbidden drugs, such as narcotics and marijuana, use of forbidden methods such as blood transfusions, and even the refusal to take a drug test. In sports, goes back centuries. In ancient Rome, athletes drank herbal infusions to strengthen them before chariot races. According to the International Olympic Committee, doping is the use of any method or substance that might harm the athlete in a quest to gain an unfair advantage over his or her fellow competitors. Classification of doping. Doping can be classified into two categories: performance-enhancing substances, physical methods. Take the time to learn about the potential benefits and the health risks of performance-enhancing drugs in next slides. Enhancing substances. Stimulants are such drugs that excites any bodily function, but more specifically stimulate the brain and central nervous system. For example, caffeine, cocaine, amphetamine, etc. Anabolic steroids are anabolic and increase protein within cells, especially in skeletal muscles. It may cause liver damage. Hormones are hormones that consist of amino acids. Example of such hormones are insulin, erythropoietin, etc. Beta-2 agonists, bronchodilators, are a group of drugs prescribed to treat asthma and relax the muscles that surround the airway. Narcotics are used to reduce the pain and allow athletes to make persistent efforts for a longer time. Diuretics are used to remove fluids from body and is used in weightlifting, boxing, etc. to reduce weight. Methods. These include blood doping, chemical and gene doping. Blood doping is the practice of boosting the number of red blood cells in the bloodstream in order to enhance athletic performance. In gene doping, athletes would modify their genes to perform better in sports. Substances and methods. The World Anti-Doping Prohibited list identifies substances and methods that athletes cannot use. World Anti-Doping Agency or WADA is responsible for maintaining and updating these substances annually. In case any athlete takes drug for therapeutic use, he or she should inform the International Federation for exemption. Prohibited at all times anabolic steroids such as bolandiol, boldenone, clenbuterol, danazol, zeranol, etc. are prohibited in or out of competition. Beta-2 agonists such as phenterol, hygienamine, indacaterol, metoprolol, pirbuterol, terbutaline, etc. are prohibited. Hormones such as insulin, corticotrophins, growth hormone, etc. are banned as they increase muscle growth. Diuretics and masking agents such as albumin, amiloride, bumetanide, canrenon, dextrin, etc. are also banned in and out of competition. Metabolic modulators such as tamoxifen, bicalutamide, exemestane, tamoxifen, etc. are prohibited. These are often used in the treatment of cancer. Prohibited at all times or in and out of competition. Blood doping and oxygen transport to increase red blood cells and other techniques that enhances the oxygen carrying capacity are prohibited. Gene doping, the transfer of polymers of nucleic acids or the use of normal or genetically modified cells is totally prohibited. Chemical and physical manipulation, tampering or attempting to tamper samples collected during doping controls is also prohibited. Prohibited in competition. Stimulants such as ephedra, cocaine, etc. are prohibited in competition. Some narcotics such as fentanyl, morphine and oxycodone are also prohibited. Cannabinoids such as hashish, marijuana, etc. are prohibited. Glucocorticoids are a type of steroid hormone which exert anti-inflammatory actions. They are prohibited in competition. Prohibited in particular sports. Alcohol is prohibited in certain competitions such as archery and karate. Beta blockers that reduce blood pressure are prohibited in shooting, golf, etc. We all have a responsibility to keep sport clean. We have some rights and responsibilities relating to drug testing in sports. Responsibilities. During doping control, athletes have certain responsibilities that are following: remain within the sight of sample collection personnel, produce identification, comply with sample collection procedures, report immediately to the doping control station for testing unless delayed for valid reasons, maintain control of one sample until it is sealed. Test yourself. A foundation initiated by the International Olympic Committee to promote, coordinate and monitor the fight against drugs in sports is known as A. World Auto Duel Association, B. Washington Area Darts Association, C. Wisconsin Athletic Directors Association, D. World Anti-Doping Agency. D. World Anti-Doping Agency. Explanation. The World Anti-Doping Agency is a foundation initiated by the International Olympic Committee to promote, coordinate and monitor the fight against drugs in sports. The World Anti-Doping Prohibited List identifies substances and methods that athletes cannot use. World Anti-Doping Agency or WADA or WADA is responsible for maintaining and updating these substances annually. Of prohibited substances. Anabolic steroids increase the risk of cardiovascular disease, liver disease, and high blood pressure. Common psychological or behavioral changes include mood swings, aggression, mania, depression, and dependence. Cause increased and irregular heart rate, dehydration, overheating of the body, and dry mouth, etc. Peptide hormones increase the risk of heart attacks, strokes, etc. Agonists cause trembling, headaches, and risk of cardiac arrest. Diuretics cause dehydration. It may also cause kidney damage. Steroids increase blood sugar level, osteoporosis, ulcers, gastritis, etc. Cannabinoids may cause rapid heartbeat, dizziness, depression, hallucination, low blood pressure, paranoia, panic attacks, and food cravings. Aids and doping in sports. Ergogenic is defined as tending to increase work. An ergogenic aid can be broadly defined as a technique or substance used for the purpose of enhancing performance or remove subjective restraints which may limit physiological capacity. Ergogenic aids. These aids fall into the following categories. Mechanical aids include altitude training, aqua, water training, heart rate monitors, nasal strips, treadmills, sports clothing, timing equipment, vibration training, etc. Aids such as amphetamine, beta blocker, caffeine, magnesium, etc. are also used to enhance performance. Bicarbonate of soda, sports drinks, etc. are included in nutritional aids. Physiological aids include acupuncture, altitude training, blood doping, herbal medicines, sports massage, ultraviolet rays, etc. Aids such as centering, cheering, hypnosis, imagery, meditation, music, psychology, relaxation also tend to enhance the performance. Ergogenic aids. Some ergogenic aids have harmful side effects and some have even been banned in professional sports. So these aids are divided into safe ergogenic aids and harmful ergogenic aids. Ergogenic aids. These include the following. By increasing the calorie intake on proper nutrition basis, high performance can be achieved. Carbohydrate loading enhances the amount of glycogen in the body before competitions. Various relaxation techniques help to maintain positive physical and mental states. Ergogenic aids. Blood doping is a very dangerous ergogenic aid. Human growth hormone helps to regulate body composition, body fluids, but it may cause chronic kidney disease. Anabolic steroids is a group of harmful drug that is taken by wrestlers, weightlifters, powerlifters, etc. to enhance weight, size and strength. If you are selected for testing, you have to follow a doping control procedure that is discussed on next slides. Doping control procedure. Doping tool is done on athlete by WADA or WADA. This agency checks and controls doping in sports. In India, the coordinating body under the WADA is named as National Anti-Doping Agency or NADA. Steps involved in doping control. Selection of athletes should be random anytime and anywhere throughout the year. The doping control officer should inform the athlete about his or her rights and responsibilities. It is required to report to the doping control station as early as possible. Athletes should verify that the collection vessel is empty, clean, and its packaging is intact. The athlete will be offered a choice of sealed sample collection kits. The athlete should confirm that the sample code numbers on the bottles, lids, and container should match. Of the urine is poured into the A bottle and 30 ml into the B bottle. The DCO seals each bottle inside a plastic bag and places them back into the cardboard container. Measures the density of the samples to ensure that it is not too diluted to analyze. All the details of the doping control, both blood and urine samples, are recorded on a single form made up of several sections. Are sent to a WTA accredited laboratory. If the result of sample A is found to be positive, sample B is tested. The laboratory will send the results to the responsible anti-doping organization or ADO and WADA. A method to increase the count of red blood cells is called A. Blood doping, B. Gene doping, C. Chemical manipulation, D. Physical manipulation. The answer is A. Blood doping. Explanation. Blood doping is the practice of boosting the number of red blood cells in the bloodstream in order to enhance athletic performance. A higher concentration in the blood can improve an athlete's aerobic capacity and endurance. Using artificial oxygen carriers is also a second method of blood doping. All methods and techniques of blood doping are illegal in professional sports. This chapter. Doping is the use of prohibited substance or method to improve sports performance. Doping can be classified into two types: performance-enhancing substances, physical methods. There are various responsibilities of athletes with regards to the anti-doping policies and rules of the World Anti-Doping Agency. These are substances, food or training methods that enhance energy production, speed up recovery and give mental or physical edge while exercising and competing. These include mechanical aids, pharmacological aids, physiological aids, nutritional aids, psychological aids. The procedure for carrying out doping controls is clearly defined by the World Anti-Doping Agency, WADA's International Standard for Testing, IST.